Methamphetamine, meth for short, is a powerful, highly addictive stimulant that affects the central nervous system. Also known as chalk, crank, ice, and crystal, among other terms, it takes the form of a white, odorless, bitter-tasting crystalline powder that easily dissolves in water or alcohol. Crystal methamphetamine is a form of the drug that looks like glass fragments or shiny, bluish rocks. It is chemically similar to amphetamine, a drug used to treat ADHD and narcolepsy. Methamphetamine was developed early in the 20th century from its parent drug, amphetamine, and was used originally in nasal decongestants and bronchial inhalers. Like amphetamine, methamphetamine causes increased activity and talkativeness, decreased appetite, and a pleasurable sense of well-being or euphoria. However, methamphetamine differs from amphetamine in that, at comparable doses, much greater amounts of the drug get into the brain, making it a more potent stimulant. It also has longer-lasting and more harmful effects on the central nervous system. These characteristics make it a drug with high potential for widespread abuse. Methamphetamine is classified as a Schedule II drug because it has a high abuse potential, but it is approved for medical purposes, such as treating ADHD, and can be prescribed with restrictions. People can take methamphetamine by inhaling or smoking, swallowing, snorting, or injecting the powder that has been dissolved in water or alcohol. Because the high from the drug both starts and fades quickly, people often take repeated doses in a binge and crash pattern. In some cases, people take methamphetamine in a form of binging known as a run, giving up food and sleep while continuing to take the drug every few hours for up to several days. Methamphetamine increases the amount of the natural chemical dopamine in the brain. Dopamine is involved in body movement, motivation, pleasure, and reward. The drug's ability to release high levels of dopamine rapidly in reward areas of the brain produces the rush or euphoria that many people experience. Taking even small amounts of methamphetamine can result in many of the same health effects as those of other stimulants, such as cocaine or amphetamines. These include increased wakefulness and physical activity, decreased appetite, faster breathing, rapid or irregular heartbeat, and an increased blood pressure and body temperature. Long-term methamphetamine use has many other negative consequences, including extreme weight loss, severe dental problems, intense itching leading to skin sores from scratching, anxiety, confusion, sleeping problems, violent behavior, paranoia, which is the extreme and unreasonable distrust of others, and hallucinations, which are sensations and images that seem real, although they aren't. In addition, continued methamphetamine use causes changes in the brain's dopamine system that is associated with reduced coordination and impaired verbal learning. In studies of people who used methamphetamine over a long period of time, severe changes also affected areas of the brain involved with emotion and memory. This may explain many of the emotional and cognitive problems observed in those who use methamphetamine. People who inject methamphetamine are also at an increased risk of contracting infectious diseases such as HIV and hepatitis B and C. These diseases are transmitted through contact with blood or other bodily fluids. Methamphetamine use can also alter judgment and decision-making, leading to risky behaviors such as unprotected sex, which also increases risk for infection. Methamphetamine use may worsen the progression of HIV or AIDS and its consequences. Studies indicate that HIV causes more injury to nerve cells and more cognitive problems in people who have HIV and use methamphetamine than it does in people who have HIV and do not use the drug. Cognitive problems are those involved with thinking, understanding, learning, and remembering. A person can overdose on methamphetamine. An overdose occurs when the person uses too much of a drug and has a toxic reaction that results in serious, harmful symptoms or death. Methamphetamine overdose can lead to stroke, heart attack, or organ problems such as kidney failure caused by overheating. These conditions can result in death. Methamphetamine is highly addictive. When people stop taking it, withdrawal symptoms can include anxiety, fatigue, severe depression, psychosis, and intense drug cravings. While research is underway, there are currently no government-approved medications to treat methamphetamine addiction. So, avoid a tragic death and stay away from meth. Thank you for taking the time to watch my infomercial.